terminology in Navajo. Common translations inaccurate and misleading. When you go to the hospital, we had a diabetes terminology that was written, and I still hear on KTNN, our local radio station, they're still using sugar. So right now, the new terminology that we're trying to implement here for the sore that does not heal, just like they say, it's a taboo word that we think of in the traditional way. So why not change the word and make it simple so it's not so scary? And next. How do you explain it? Sore that does not heal, defeats goals of screening, defeats goal of early detection and treatment, brings an attitude of no hope. So right here, the terminology, we break down cells. There's a way we say cells, and we're trying to make it so that it's not where a patient comes in and then the first diagnosis, the doctor asks, this patient has cancer. So and as an interpreter, I say to the patient, you have the sore that does not heal. The doctor just said that to you. The patient's going to come out with an attitude and say, okay, this is it. There's no future for me. That's how they're going to interpret it. So now, the way it's written is, go ahead, next. The word, how this is really said and how this is going to be said from here, so it's not so harsh and not so scary, is at is all that doesn't say aro ba at holong hilego, meaning that the cell is breaking off and it's going meaning that it's inside the cell. The cell itself, we're explaining it, and just like Ophelia was saying this morning, that it's really hard to describe that. That's the only way we understand it. Just to be on the positive term, it's going to be implemented that way. So from here on, it's going to be said that way. And who is the working group? Mostly Navajo medical professionals like Dr. Garrison and Navajo Area Indian Health Services, along with Dr. Garrison's wife, Martha Austin. She's Navajo from Navajo Mountain. And Navajo Public Health Services, which is Linda Cothran, myself, and some other dignitaries from Shabbat Service Unit. Navajo Nation Division of Health, Breast and Cervical Cancer Prevention, and Public Health Nursing, Health Education. Next. Process is community-based participatory approach, direct patient care, education, community advocacy, resulting in building tribal public health capacity, support groups, brochures, improve cancer prevention. Next. Plans for the future is completion in 2009, dissemination through half-day workshops, the providers and general public, and the word of the day. Shower cards are going to be written like the Southwest exam, and the CD and DVD is going to go with it. Next. And the format of glossary is cancer term, English definition, Navajo translation, English translations of Navajo. Next. Cancer is the uncontrolled, undisciplined growth of some cells in the body. So right here, oh no, the Navajo phonics, it didn't come out good. But anyhow, I have the glossary for it, but it seems like it's written in numbers here, so I can't really say that if it's written like that. Next. Well, that's it. I'm sorry. The Navajo phonics didn't come out.